Okay, let's dive in. Summer of 2022 in Europe, the numbers were just staggering. Over 60,000 heat-related deaths.
Hmm. Yeah.
That's not just a statistic, is it? That's a huge human cost, and it really throws a spotlight on this escalating global heat problem.
It really goes.
So today on the deep dive, that's our mission. We're going to unpack this. We'll look at the hard data, figure out who's really most at risk, explore solutions people are trying, and maybe learn from what's worked and what hasn't.
Exactly.
We really want to help you, our listener, get a quick handle on what's critical in this really complex and frankly urgent topic.
And we've got some solid ground to stand on. We've pulled together research from top journals like Nature Medicine, Nature Communications, plus key guidance from the World Health Organization.
Good stuff.
Yeah, it gives us a really comprehensive, data-rich view of what some are calling the heat wave age. It's about equipping ourselves and you with the insights we need.
Okay, so we mentioned that 60,000 number. That's the human toll. But let's dig into the scale a bit more. What do the numbers really tell us? It can feel abstract sometimes.
It really can. So
Yeah.
starting with that 2022 figure, over 60,000 deaths in Europe. But put that into context. Remember the 2003 heat wave?
Oh, yeah, that was devastating.
Devastating. An estimated 71,449 excess deaths across Europe then. So this isn't like a one-off freak event. It's a persistent, dangerous threat that's been on the radar for 2 decades, and it seems to be getting worse as things warm up.
And what really caught my eye in the research, it's not just about those crazy peak temperatures. There's this concept of a minimum mortality temperature, like a temperature sweet spot for health. And in Europe, it's surprisingly cool, like 17 to 19 degrees Celsius.
That's right. It's counterintuitive.
Yeah, you go above or below that, and the risk starts climbing. It kind of challenges the idea that only extreme heat is the killer.
That's a really crucial point, and the data backs it up directly. For every single degree Celsius increase in the maximum apparent temperature, some European cities see mortality jump by 2% to 3%.
2 to 3% per degree.
Per degree. But during an actual heat wave, that increase isn't smooth. It can skyrocket anywhere from, say, 7.6% up to a massive 33.6% increase in deaths in the affected cities.
Wow, that's a huge range, 33%.
It is huge. And that range, that 7.6 to 33.6, it tells you something important. It shows how much local factors matter, things like how dense the city is, income levels, how good the health services are. They can really amplify or potentially lessen the heat's impact.
Because the vulnerability isn't the same everywhere.
Not at all, even within one continent.
Yeah.
Remember, this isn't just about lives lost, sadly. It puts immense strain on hospitals, on energy grids. It affects, just the quality of life in cities and the economy, too.
And another thing, it feels like the goalposts are shifting. We're seeing temperatures that just shouldn't happen based on past records, right? Yeah. Like Lytton, British Columbia, 2021, 49.6 degrees Celsius.
Unbelievable.
That was almost 5 degrees hotter than their old record. Statisticians were saying it was practically impossible based on historical data. It's like the climate is playing by new rules.
That is a critical point, maybe the most profound one from these sources, actually. About 31% of regions around the world have now seen daily maximum temperatures that were, well, statistically exceptional.
31%.
Yeah, far beyond what the historical trends would predict. Basically outside what we thought was normal variation. And the deep insight there is the weather data we've always used for planning. It's just not a reliable guide for future heat anymore. It means a lot of places might have just been, well, lucky so far. But that makes them really vulnerable to future unprecedented heat events.
So everywhere needs to rethink their plans based on this new, more volatile reality, not just the places already hit hard.
Precisely. It's an urgent wake-up call.
Okay, so this brings us to who gets hit hardest. We know the elderly, women, people with chronic illnesses are more vulnerable from the data. But how do these factors interact? Is it like being old and isolated makes the risk shoot up exponentially? Or are there specific combinations that worry experts most?
That's a really good question because, yeah, it's rarely just one thing. The data is crystal clear. Heat-related mortality goes up steeply with age.
Right.
That 2022 heat wave, again, over 36,848 deaths were people 80 or older. That group just consistently faces higher risk. Their bodies don't regulate heat as well, sweating response can be delayed, and often they have other health issues too.
Comorbidities.
Exactly.
Yeah.
And women, as you said, bear a disproportionate burden. In 2022, 63% more heat deaths estimated in women than men, especially women over 65 and particularly over 80.
Why is that?
It can be a mix of things, some physiological differences, but also social factors, maybe living longer, different living situations. But to your point about interaction, It's the compounding of these vulnerabilities that creates the absolute highest risk.
Yeah.
Someone who is elderly, has a pre-existing condition, lives somewhere that gets really hot inside, and is maybe socially isolated.
Hmm.
That's a truly dangerous mix.
Which leads us straight to those health conditions. It's not just about age or gender, is it? What specific conditions or even medications make people more susceptible?
Absolutely critical. People with chronic diseases are at much higher risk. We're talking cardiovascular conditions, breathing problems like asthma or COPD, psychiatric disorders, diabetes, kidney disease.
Why those specifically?
Well, they can directly mess with the body's cooling system. Heart conditions might mean the body can't pump blood effectively to the skin to release heat. Kidney issues can affect fluid balance. Diabetes can impact sweat glands. It compromises the body's natural defenses. And even medications can interfere. Some drugs, like certain ones for mental health conditions or heart problems, can reduce sweating or cause blood pressure to drop dangerously if someone gets dehydrated.
Wow, I hadn't considered the medication angle as much.
It's significant. And beyond physical health, socioeconomic factors are huge. If you're socially isolated or don't have the money for cooling or good housing, you're more vulnerable. Simple as that.
And geographically, are there hot spots?
Definitely. Around the Mediterranean, Italy, Spain, they consistently show the highest heat-related death rates in Europe. Globally, places like Afghanistan, parts of Central America, are flagged as really high-risk zones. It's often a combination of factors: high likelihood of extreme heat, growing populations, and crucially, limited access to healthcare and reliable energy.
And just to add another layer of complexity, it's not only the heat itself causing problems, is it? There's air pollution, too.
Yes, that's a nasty interaction.
Hmm.
Air pollution, especially ozone and fine particles, PM10, can work synergistically with high temperatures. They make the health impacts even worse.
How does that work?
Well, both heat and pollution stress the cardiovascular and respiratory systems. Together, the burden is just greater. And PM10 is tricky because it can get indoors. So even if you think you're sheltering from the heat, you might still be breathing in harmful particles. It undermines that seeming safe haven.
Okay, this paints a pretty challenging, urgent picture.
Yeah.
Now, for people working on climate adaptation, these heat health action plans, or HHAs, they're kind of a known tool. But what, in your view, is the real core idea, or maybe the most overlooked part, that makes these plans actually work or fail when a heat wave hits?
That's a great way to put it, because the core philosophy has to be more than just a checklist. It's about building a truly connected, responsive system for heat preparedness. It's not enough just to have an early warning system.
Right.
The key is ensuring that warning triggers a response across multiple levels, multiple sectors: health, social services, urban planning, and that it actually reaches everyone, especially those most isolated or vulnerable. It needs to work seamlessly, from the weather forecast right down to the individual care.
So it's the integration that matters.
Absolutely. So when we break down the components, it's about how they're used together. First, yes, the early warning systems, using forecasts to predict dangerous heat. Critical first step.
Okay.
But they're useless without effective communication.
Yeah.
And this isn't just putting warnings on TV. That's okay for general advice. But studies show for the really vulnerable, just passive information isn't enough.
So what works better?
Active outreach. Things like buddy systems, neighbors checking on neighbors, health workers doing home visits, even daily phone calls to high-risk individuals.
Yeah.
Making sure the message actually gets through and is understood.
And since most of us spend most of our time indoors tackling heat, there must be a huge piece of this. What's the focus beyond just cranking up the AC?
Exactly. Reducing indoor heat exposure is vital.
Yeah.
And the big shift, or the needed shift, is towards passive cooling for the long term. It's more sustainable.
What does that look like?
Think urban planning. More trees, parks, green roofs, creating shade. Even water features like ponds or fountains can cool areas down. For buildings themselves, it's about using reflective paints or materials on roofs and walls, much better insulation, designing for natural airflow, cross-ventilation.
So smarter building and city design.
Yes. Air conditioning definitely has a role. It can save lives in a crisis, but it uses a ton of energy, contributes to emissions, and can even make the outside hotter. So it can't be the only solution. We need cooling strategies that don't worsen the underlying problem.
Makes sense. What else is in these plans?
Well, targeted care for vulnerable individuals is essential. This means doctors, GPs being proactive, maybe doing pre-summer check-ins with high-risk patients, advising on staying hydrated, checking if medications need adjusting during hot weather. Telephone hotlines are important too. and specific plans for nursing homes, ensuring they have cool rooms, enough staff. This links closely with urban planning and building design, like we mentioned. Increasing green space big parks, even just 1 hectare, can noticeably cool surrounding areas. Using cooler building materials, it's about reshaping the environment itself.
And what about the emergency services, the hospitals?
Right, preparedness of health and social services. Hospitals, clinics, care homes need clear operational plans for heat waves. That means ensuring they have enough beds, potentially bringing in extra staff, maybe changing how certain drugs are used when it's extremely hot.
And tracking if any of this is working.
Crucial. That's real-time surveillance, watching health data, daily death counts, emergency room visits for heat stroke, ambulance callouts. This lets authorities see almost in real time if the interventions are making a difference and where they need to adjust quickly. It's a constant feedback loop. Learn and adapt.
So we have these plans, these elements, but the big question is, have they actually worked on the ground? Especially with these recent, more extreme heat waves. What are we learning from cities and countries trying to deal with this?
That's where it gets sobering. Despite many European countries having heat prevention plans activated in 2022, that tragic death toll, over 60,000,
Yeah.
it tells us those plans were only partially effective at best.
So, not enough.
Clearly not enough. It points to an urgent need to reassess and really strengthen these strategies, especially because, as the data shows, Europe is warming faster than the global average. These kinds of events are getting more frequent, more intense. What worked 10 years ago might not cut it now. But it's not all bad news. We do have examples where interventions seem to have made a real difference. Look at France. After that awful 2003 heat wave, they made significant policy changes.
Right.
And during another major heat wave in 2006, which was similar in intensity, they saw significantly fewer deaths. That really demonstrates that preparedness can work, that we can learn and adapt effectively.
Okay, that's encouraging. What about other places?
Chicago in the U.S. is another example. They had a terrible heat wave in 1995 with many deaths. But during a later one in 1999, the death toll was lower. Part of that was attributed to better prevention measures, opening cooling centers, more people having AC, but also, importantly, just greater public awareness.
And it's interesting how different places tailor their approaches, isn't it? Based on their specific situation.
Exactly. That local tailoring is key. Take Catalonia in Spain. They put a lot of effort into a very structured communication plan. They didn't just broadcast warnings. They used census data to identify at-risk people and did active outreach. They even planned potential transfers to designated cool shelters.
Very proactive.
Very. Or look at Rome. They developed a system to give individuals a risk score based on vulnerability factors. Then, local doctors played a central role, proactively monitoring those high-risk individuals with phone calls, home visits. Plus, they have that daily mortality surveillance system giving them near real-time feedback.
And the UK.
In the UK, they use their NHS Direct Health helpline. The data clearly shows calls about heat stroke or sunstroke spike right alongside temperature increases.
Yeah.
It shows people are reacting to the heat stress and using the available resources, which highlights the value of accessible health advice lines.
So these specific examples show that while the challenge is huge, tailored, proactive, and well-communicated strategies can make a difference.
They can, but the lesson from 2022 remains stark.
It seems the absolute key takeaway is this need for constant learning, constant adaptation, constant evaluation. We can't just implement a plan and assume it's done. Every heat event has lessons.
Precisely. And connecting this back to the bigger picture, the 2022 experience in Europe is a clear warning. Past efforts, however significant they were at the time, are simply not sufficient for the reality we're facing now, and certainly not for the future. The unprecedented is rapidly becoming the expected.
Right. We can't rely on history as our guide anymore.
You really can't.
And that leaves us, and you listening, with a pretty profound question, doesn't it? When the unprecedented becomes the expected, how do we move beyond just reacting? How do we genuinely reimagine our cities, our communities, our daily lives to actually thrive or at least survive better in a hotter world? It feels like we have to go further than just immediate prevention plans. We need to embed deep, long-term adaptation into everything, our urban planning, our infrastructure, our building codes, even just our collective awareness and how we look out for each other.
Yeah.
That seems like the only way to build true resilience against this intensifying threat.